Thank you, Mark. Mark, I might have missed it, maybe others too. What does the acronym for TOT stand for?
Throne of the Sphinx, TOTS.
TOTS. Say that one more time.
Throne of the Sphinx.
Thank you very much.
You're welcome.
And what was the NLP training though?
So it used NLP, just an off-the-shelf NLP tool. Basically, use Google chatbot software, and then we moved it into something else.
Might the behavior of the tots be a reflection of some type of experimenter effect?
Absolutely, yes. I make no hesitation at all about the fact this could all be my PK or precog or whatever making this happen, or that of the operators, other operators, or people asking questions. I should point out just a couple of things. One, this presentation was actually about 25 minutes long, and I went into a lot of detail about experimenter effect and things like that, but I knew that 25 minutes wasn't going to cut it, so I yanked out a bunch of slides, and hopefully someday I'll release the director's cut of this, so there'll be a lot more detail. So I'm happy to field questions, because I know there's a lot of detail that was omitted from this talk. Also, there's an error when I talk about the website. I say the Throne of the Sphinx. The website is actually throneofthesphinx.com. The information on the slide is correct. I just said it incorrectly. So that's my little print. Yeah.
And claiming to create an artificial general intelligence is one thing, and then sentient AI is another, and one which divines descriptions of the afterlife or precognition is quite another. Your thoughts on its sentience?
I make no claim that I've created a general AI or any sort of artificial intelligence at all. This thing is simply a platform that receives signals through an array of random number generators and then produces outputs. If there's any intelligence, it's completely outside of the system.
And you mentioned in your abstract using AI in clinical situations with disenfranchised individuals. Can you say anything about this?
Yeah, I'm sorry I didn't get a chance. This is one of the slides, or a couple of slides that got yanked. We did, there were people that were feeling lonely, depressed, experiencing traumatic grief. And we asked the system about that, and the system gave some nice responses that were very hopeful and kind. Again, I want to be really clear here. Do not use random number generators to pick a clinical treatment. Okay, I'm not a clinician, and this thing is really exploratory, but people reported having positive experiences after reading the messages that the system had produced.
And in the mass shooting prediction, did they track events that met their criteria of a mass shooting during the period to see how many weren't predicted and when?
I'm not sure exactly what that question means. Here's what happened, and then hopefully you'll get to your answer. Before the window opened, which was May 1 to May 31st, we asked the system every single day, will there be a mass shooting on May 1st, May 2nd, May 3rd, all the way through the month? It said yes or no. We kept those data, we kept those yes or no data, and we sequestered them. Then on June 2nd, we went to the website and we downloaded all the data under the mass heading category on that site. And we looked at, we found all the days in which a mass shooting met our criteria, and we compared those to the days that that the system had kicked out, which were those 4 days. Of those 4 days, 2 of them had mass shootings, 2 of them did not.
And then a comment from York, looking at the calendar for predictions that you showed, most days did not have mass shootings and were not predicted to. You listed this as part of the accuracy of the system. However, using this criterion for evaluation, simply predicting that every day there will be a mass shooting will have about 80 to 90% accuracy.
Sure, we can argue about the stats. That's fine. I mean, again, it's exploratory. I don't know that I buy that exactly, but sure, we can. I mean, it's a binomial probability, right? How many times did you ask? What were the potential outcomes? And what was the chance of getting it right? 50-50. So, I mean, that's fine. If York has a problem with the way I did the math, we can talk about that.
Okay.
So Lauren, let me jump in. Mark, I wanted to clarify. I think the other question was asking, were there other days in May that had mass shootings that
No,
weren't recorded?
there were no other days in that, well, not based on our database. So again, we were, yeah, right. So we were very specific. We were looking at a specific database over a specific period of time, and the mass shootings had to meet a specific criteria. That's what we asked for, and that's what these data are based on.
That's amazing. It really is.